I want to take this opportunity to give a little bit of backstory about how the Pillar Tribe, Shield Mission, and OxyKit program got started. Maher Daoudi and I were put in touch by a mutual acquaintance in the very early days of the COVID pandemic as it started to impact the United States. And what we were really talking about at that time was what we were seeing clinically in terms of hypoxia, and then the real potential for our healthcare systems to get overwhelmed. And we were talking about it both in terms of what was happening in the springtime and then what potentially could happen this fall and winter as a second surge happens, along with the possibility of influenza and other seasonal illnesses that tend to happen at that time. So based on our conversations, we identified a real concern that as hospital systems become overwhelmed, there simply wouldn't be enough ventilators, enough access to oxygen, and really enough hospital beds and hospital staff. And we began talking about what could be done to help mitigate this. And this is where the idea of an oxygen concentrator that could be built at home came from, with the idea of offloading hospital systems. So Maher put together a really amazing group of engineers and business leaders and physician leaders and people in different industries to get working on this program, and came out with this amazing DIY oxygen concentrator that we're now pushing out around the world. But what happened during this is a couple of other developments actually happened. One is we started to see and hear about these cases of silent hypoxia, or so-called happy hypoxia, where patients were coming in profoundly hypoxic with really low oxygen levels and weren't even aware of that. And the concern for what could potentially happen to the body, to the organs, and at the cellular level if you're walking around with really low oxygen levels. And we also started to talk about what potentially could be done outside of the hospital system. You know, if somebody is stable and has a low oxygen level and can actually do okay with high flow oxygen, wouldn't it be better to offload the hospital system and keep those patients out of the hospital, which are a risky place anyway, and have them have oxygen monitoring at home and get their oxygen at home? So that was one of the additional developments. And the idea with this is if you can monitor somebody's oxygen levels at home and do that remotely and provide them with the oxygen they need, and if they start to not feel well or their oxygen levels go down, then they could be directed to the hospital systems for an escalation of care. And this way, you really offload the hospital systems and get the patients the critical care that they need. And so that's where we started to move this program and started to look at remote monitoring of oxygen levels and other vital signs. And then another development that happened within all of this is it became very obvious to us that within the United States, hospitals have oxygen, and you plug a tube into the wall and have immediate access to that for patients. But in more rural areas and in other countries, especially more developing countries, they don't have access to oxygen, and patients are dying because they don't have access to what we consider a really basic part of healthcare. And that's where the impetus came from for us to really start to look at this from a global perspective and what we could do to help individuals, physicians, engineers, anybody who has any building ability to push out the videos and the instructions about this DIY oxygen concentrator to allow them to be built in other countries and provide life-saving access to oxygen. So that's where we are now, is working to push this out both within the United States as well as worldwide, tapping into philanthropic organizations and charitable organizations to try to get some financial support in those countries to allow them to purchase the parts that they need.